heart and lung sounds, they can do that. They can also do different interventions and make decisions about when to do those interventions. So they can provide airway support as well as ventilation or breathing. They can give a variety of different medications by IV route, sublingual, oral route, etc. They can start an IV, and finally they can hang different types of IV mixtures with medications in them, and we often call those drips or continuous infusions. So the student can control all these things by using the arrows, by dialing in, arrowing up or arrowing down how much the dosage of the different drugs are, selecting a route, and then finally clicking on administer. And he's having pain in his chest. It feels like an elephant on his chest. Okay. Well, with that in mind, I'm going to go ahead and I just noticed up on the ECG monitor there's some extra beats occurring up there. So I'm going to go ahead and apply some oxygen to him. And I'm going to head, and as that's connecting up, I'm going to dial up the oxygen to 4 liters. So now we have 4 liters, and he has oxygen on.
Better.
And that's better, he says. Okay, and just because he's having the pain and because of those extra beats up there, I'm going to go ahead and start an IV.
Ouch.
Ouch, he says. Sorry, Mr. Pau. And then I'm going to walk around here and go ahead and set one of the pumps. And I'm just going to set it at about 30 mLs per minute, which is actually, I had preset this, but I could adjust it various rates here. Maybe I'll set it at 50. Let's set it at 50. Okay, so now we have an IV running in. And because he is having some extra beats here, and we need to treat those with a medication, I'm going to go ahead and treat him with a medication. So if you look in the chat line, you'll actually see the medication that I'm going to give him. I'm going to give him some lidocaine IV. And there, you probably saw in the chat, I administered 100 milligrams intravenous lidocaine. And the other thing I can do is go ahead and hang a drip. I'm going to hang a drip of lidocaine. And are you okay, Mr. Pau? I'm going to go ahead and start the pump here.
Feels strange, kind of lightheaded.
Uh-oh, he doesn't feel well. It's kind of strange, lightheaded. I'm going to just adjust this rate here. Time to check his pressure, probably. And I can just go ahead and check another pressure. See where he's at. I need to watch him pretty closely though, because he's not feeling real well. Let me give him some nitroglycerin maybe. His pressure's up. And oops, another rhythm, an emergency rhythm. I guess I'm not going to give him nitro. We've got to do some other things. First thing I'm going to do is turn up his oxygen and actually put a bag on him. Because I'm going to need to breathe for him. And I'm going to crank up his oxygen to much higher, like to 15. I'm going to walk to the end of the bed here. And I'm going to bag him. The other thing I need to do is go ahead and start CPR, assuming my defibrillator's not ready yet, so we'll just show you that part. Maybe bag him some more here. And you have to just trust me on that I was bagging there. And the other thing I need to do, I do have a defibrillator ready, and so I'm just going to go ahead and charge this thing up and attach the paddles. The paddles are attaching, and I'm going to go ahead and charge it up. Let's charge it to 360. I'm going to turn it up a little bit. There's the charge. And then I'm going to walk over to the patient, and of course look around, stand clear, look around, make sure everybody's clear, and I'm going to go ahead and defibrillate. There, I defibrillated. Actually, I knew his rhythm was, his pressure would have been down. I didn't show you his pressure, but it was going down to 0. But now I've defibrillated, and he's actually back in, looks like a sinus rhythm. So we're doing much better. It looks like we got him out of it with the one defibrillation at 360.